Okay, so hi, I'm Alexa Karadinas, and today we're going to be presenting on Planned Parenthood and reproductive care on behalf of Lambda Kappa Sigma Alpha Beta chapter. So for a quick overview about Planned Parenthood, they were founded in 1916 and there are more than 600 locations throughout the country. They provide reproductive and healthcare options for preventative services to individuals from all communities. And Planned Parenthood also offers a lot of education on sexual health, STIs, pregnancy, and many other health-related options for patients. They're strong advocates for women's and reproductive rights, and they support research for reproductive and sexual health. Planned Parenthood also helps offer access to healthcare and resources across the world, having partners in Africa as well as Latin America. So some of the goals for this presentation include increasing the awareness of Planned Parenthood and the services that they offer, educating viewers about where Planned Parenthood locations can be found and the ways that patients can make appointments or access the resources that they provide, to inform people of the state and federal regulations that are in place involving abortion and reproductive care, and finally, to provide people with the resources that are necessary so they can learn more about Planned Parenthood and how they can easily take advantage of the resources that Planned Parenthood offers to benefit their health. So Planned Parenthood offers numerous services for their patients, which we'll go into more depth in throughout the course of this presentation. But for a brief overview, some of these resources include providing general health services, screenings and testing, abortion services for women, offering various birth control options, emergency contraception methods, LGBTQ services, sex education on various reproductive and other health topics, and additionally other methods for emergency contraception. So there's a wide range of services provided by Planned Parenthood, and we're going to get into the specifics of each.
All right. Hi, everyone. My name is Suneri. Touching on some of the abortion services that Planned Parenthood has to offer, they not only provide you with the resources that you need, but they also give you factual information about what options you have. They hold in-clinic abortion procedures, they give the pill, as well as provide referrals. So if your Planned Parenthood in your area does not provide abortion services, they can tell you about your options, find providers in the area that do perform these services, answer any questions that you have, and they will also offer post-abortion follow-up exams. And in regards to the consent that you need to provide, if you are under the age of 18, some of the states will require you to tell or get permission from a parent or guardian that you are getting an abortion. But keep in mind that you may be able to get consent from a judge to excuse you from this requirement. And just for your information, in Connecticut, the parents or legal guardians of a minor must be notified of the abortion, but it's not a requirement that they are involved in the decision-making process. And then talking about birth control, it's important to note that birth control is not a one-size-fits-all solution. There are many different options and they're used for a whole bunch of different reasons. So some people may have health problems, problems with menstruation, contraception, and these are also some of the examples below. And as you can see, a lot of the uses vary. It's not just for contraception, but they can also take care of cancers as well as infections, and also administration of some of these are very different as well. Planned Parenthood stays up to date with all the new forms of birth control, as well as the advantages and disadvantages of each. And their website separates each form of birth control based on categories like what's most effective at preventing pregnancy, what's the easiest to use, what helps with periods, what helps prevent STDs, what contains less or no hormones, and what may require a doctor or nurse intervention to be required. They also include information about what form of birth control contains hormones, how you would use them, and like I said, the benefits as well as the drawbacks of each. That's all. And then as far as emergency contraception goes, most Planned Parenthood centers will talk to you about the morning after pill. They may even be able to provide them at their centers, and this can help prevent pregnancy for up to 5 days after unprotected sex. You don't need a prescription for this, and usually they're available at your local drugstores as well as grocery stores and some of the Planned Parenthood centers. Other options may require an appointment or healthcare provider referral, and these include the copper IUD and the Ella morning after pill. The sooner that the morning after pill is taken, the more likely that it will be effective in preventing pregnancy. And then as far as pregnancy testing and services go, Planned Parenthood also informs either parents who are looking to plan to become pregnant or provides them with education regarding childbirth, postpartum, miscarriages if one suffers from it, as well as prenatal care. They also assist in adoption services as well as referrals.
Planned Parenthood also offers some general healthcare services, which include anemia testing, checkups for sexual health problems, cholesterol screening, colon cancer screening, diabetes screening, employment, sports and routine physical, flu vaccines, high blood pressure screening, rape crisis counseling, tetanus vaccination, smoking cessation, thyroid screening, UTI testing, and treatment. Not all of these services are offered at every location, but it's also important to note that routine visits with a healthcare provider are very important to one's health. So it's great that they offer these general health services. HIV, LGBT, and men's services. Planned Parenthood offers HIV services to help prevent, treat, and support HIV patients and their partners. These include HIV testing, HIV test education, HIV referrals, HIV case management, and HIV prevention, which includes PrEP and PEP. Pre-exposure prophylaxis is for people who do not have HIV, but it should be taken daily prior to exposure, and post-exposure prophylaxis is taken only in emergency within 72 hours after possible exposure. They also offer LGBT services, including drop-in center, education, hormone therapy for transgender patients, resources and source referrals, and support groups. They provide a safe and welcoming place to get healthcare and information. And for men's health services, men can come for routine exams or specific health concerns. They provide care, screening, treatment available for erectile dysfunction, male infertility, premature ejaculation, testicular and prostate cancer, male sterilization, and other services. Sex education and STDs. Planned Parenthood is the #1 provider of sex education in the country for adults, teens, and parents. Some examples of the topics that they provide education on are including but not limited to midlife and menopause, abstinence, birth control, fertility, HIV and HPV, pregnancy, cancer screening, safe sex, and erectile dysfunction. They also offer STD testing, treatments, and vaccines. STD testing services are offered for chlamydia, genital warts, HPV vaccination, gonorrhea, Hep A and Hep B vaccines, herpes, syphilis, and trichomoniasis. STDs are difficult to self-identify due to lack of symptoms, but Planned Parenthood centers offer quick and easy testing for STDs in a non-judgmental environment. And for women's services, Planned Parenthood offers essential reproductive and sexual health services for both specific need or general routine examination. Some of the general routine services that are offered are Pap tests, pelvic exams, cancer screenings, testing of vaginal infections and UTIs, breast exams, mammogram, and mammogram referrals. Specific need services include cryotherapy, incontinence, infertility, colonoscopy, LEEP, which is loop electrosurgical excision procedure to remove abnormal cells from cervix, menopause testing and treatment, sexual response education, and treatment of vaginal infections and UTIs.
Hi guys, my name is Maddie. So for patient population, as you can see, there are many people who use Planned Parenthood services and many that you would not even think of. So they are one of the nation's leading providers for women, men, and young people. And there are 3 million patients worldwide every year who use their services. In the US, 1 in 5 women has visited a Planned Parenthood health center, and they serve every community and income level, which is very important. 75% of people have incomes at or below 150% of the federal poverty level, so they are really helping people. 85% are 20 or older, and 21% of patients are Latino, 15% are African American, and 11% are male. So you can type in your location on the website and find all of the services that they are providing, and you can see exactly the places near you and if they provide abortion and all of the services. As for Connecticut locations, they're located in Bridgeport, Danbury, Enfield, Hartford, Manchester, Meriden, New Haven, New London, Norwich, Stamford, Torrington, Waterbury, West Hartford, and Willimantic. And to set up an appointment, it's definitely important to keep in mind with COVID and everything going on that you can also use telehealth. So to set up an in-person appointment, you can call the health center, or you can also set it up online, and you can see available appointments by selecting your nearest location. And also for virtual telehealth, you would just select telehealth on the website, or you can call, and some health services are offered by phone or video. So this is important to keep in mind.
Hi everyone, my name is Bella, and I'm going to be going over the state and federal regulations that impact reproductive care and free clinics. So Planned Parenthood of Southern New England will stop accepting federal family planning funds instead of adhering to new rules that bar the women for abortions. In 2019, 16 Planned Parenthood clinics in Connecticut did not accept federal funding since they did not want to adhere to the gag rule, which creates more barriers to healthcare. Abortions during the 3rd trimester or post-viability, which means that the fetus would most likely to be able to live outside of the uterus, are prohibited in Connecticut. Connecticut also enforces the TRAP laws, which are targeted regulation of abortion providers. And these laws require that abortion clinics and doctors who perform these abortions have more strict regulations on their facilities. During the COVID-19 pandemic, the Connecticut Attorney General took steps to increase access to the reproductive health care. And along with 21 other states, Connecticut requested that the FDA make plans to increase the access to reproductive health care, including abortions. Connecticut law also states that if Roe versus Wade was weakened or overturned, abortion in Connecticut would remain legal. So now for the federal regulations, there's the Hyde Amendment, which is Medicaid funding is withheld from abortion nationwide, so only small exceptions are made. The federal abortion plan, which states that abortion is a criminal offense for pregnant women who are in the 2nd trimester. Also going along with this, it's saying that from a medical perspective, many doctors have said that if this law is allowed to stand, it would severely limit their ability to provide their pregnant patients with the safest care available. Next is the federal/state 20-week bans. So some states will have 20-week bans in which people who wish to have an abortion for serious medical conditions cannot do so. The The majority of abortions occur in the first trimester. However, this restriction bans abortion 20 weeks after the patient is pregnant, which eliminates this medical option as a potential decision. Also, there's the TRAP laws, which are directed against abortion providers, and insurance restrictions on abortions. So if you're interested in learning more, you can go on the PlannedParenthood.org website. Planned Parenthood's website is filled with a lot of information on the different services that they provide. They have in-depth facts about each of their services and how to stay healthy. It contains information on how you can get involved to take action in ways like donating, volunteering, and much more. They have options to set up appointments, both in person and virtually with a provider. And they also have options that can help you to enroll in a healthcare plan. There are many services that Planned Parenthood provides, and by simply visiting their website, you can gain a lot of access to all of the different care options and find out how they can help provide you specifically with like access to your healthcare needs. And then there's just a list of our references that we use within this presentation.
Okay, and thank you so much for watching. We hope you learned a lot about Planned Parenthood and can now access all of the services that they offer.